Disciplinary team of respiratory therapy, nursing, occupational therapy, physical therapy, and nutrition is gathered to start rounds on the patients in the NICU. In order to better prepare ourselves for caring for our patients, we undertake a sensory awareness and mindfulness exercise informally known as the 5 Jewels of QiGong. We start with 3 stacked breaths in and out to prepare ourselves for this exercise. With the exhalation of the 3rd breath, we start the arms pumping. We aim to move in such a fashion that we attempt to provide the least amount of effort to keep the arms in motion with a smooth, languid cadence that allows the rest of our body to relax. While we pump our arms, we bring our attention to our posture and imagine a hook slightly above the crown of our heads. We reach up and hook on with the crown of our heads, and then unlocking the ankles, knees, and hips, we allow our pelvis to hang down like an anchor on our spines, stretching, elongating, and unencumbering our torsos. And we now imagine a light, ergonomically sound posture that allows for ease of motion and improved sensory awareness. As we settle into this posture, we can imagine a crystal clear spring rising in us as we pump our arms. This spring brings water from our feet through our bodies and out the top of our heads, purifying, rejuvenating, and resetting our bodies as it courses through us. We imagine this water entering our feet, washing the muscles and ligaments of our feet. It rises into our ankles, replacing the synovial fluid, and rises through our calves. Here it flushes the lactic acid and promotes a lengthening and softening of the calf muscles. The water climbs into our knee joint, replacing the synovial fluid there, and promotes suppleness and strength in the surrounding joint capsule. The water continues to climb into the largest muscle groups of our body, the hamstrings and quadriceps muscles. Here too it promotes flushing of the built-up lactic acid stores and lengthens and softens the tension in the muscles, and vascular perfusion to the muscle improves. The water keeps climbing through the legs past the pelvic floor muscles, softening them as well as it makes its way into the abdomen. Here it washes and resets the abdominal organs. The liver is helped to detoxify, the kidneys are aided in filtration, the intestines are aided in absorption, contractility, and motility. The abdominal wall muscles are softened, and we begin to breathe with the belly breathing that characterizes the neonates that we take care of on a daily basis. The water crosses the diaphragm, and the diaphragm itself softens and deepens its excursion with every breath. The abdomen as a whole enjoys a rhythmic massage brought on by this deeper, full belly breathing. As the water enters the thorax, we shift our awareness to the interlocked pumps of circulation and ventilation that are contained therein. The lung units are washed, and as the breath gets deeper, additional lung units get aerated, allowing more oxygen entry and enhanced expiration of carbon dioxide. Pulmonary vascular resistance drops, and the right side of the heart finds it easier to pump blood to the lungs. Blood returning from the lungs is better oxygenated, and this improves function of the left side of the heart as well. The peripheral vasculature is already relaxed with the improvement in tension in the muscles, and thus our blood pressure normalizes. The cardiopulmonary circuit is happy, and this leads to a sense of generalized well-being in the body. The water continues to rise through the neck, washing the structures of the neck, and rises into the brain and out the top of the head, flushing the thoughts, emotions, and behavioral patterns that are no longer necessary for efficient function. The green light comes on, and our wash cycle completes. We are left with a body and mind that is present, mindful, and prepared for the care of our patients. The 3rd jewel is activation of the prenatal chi, or lower back massage, facilitating erythropoietin release from the kidneys, providing us with energy and improved oxygen carrying capacity. Massage is effective at mobilizing, activating, and rejuvenating the lower back and preparing the body for activity. 4th jewel is to march. The core intention to move emanates from our dantian, or energy center. We begin to march in rhythm and allow the amplitude of the march to get higher, not by increased effort, but rather by removal of tension and resistance to motion, wherever we may find it. We examine the shoulders, the torso and spine, the hips, the knees, and the ankles for sources of pain, tension, or resistance, and see if we can gently soften these inhibitors to movement. We allow the amplitude of the march to slowly subside, allowing the effort to come to a rest naturally and gently back to stillness. We pause in stillness, we allow ourselves to become more aware of the sensory feedback returning from our skin and muscles. With this pause in movement, one can become aware of sensations, buzzing, tingling, heat, pain, tension, stretch, and all of the varied sensory information coming back from the body's network of receptors. Allowing our attention and awareness to rest here for a moment enhances our connection to the world around us by allowing ourselves to feel what the world through our body is presenting to us. This in turn allows us the better capacity to take care of our patients by becoming more aware of their needs. The fifth jewel is the circle of life. We need enough space to perform a full arm circle without interference. With the in-breath, we allow our hands to ride the breath upwards in front of us and out to the periphery. With the exhalation, we allow our arms to drop down to the center, completing the circle. We again attempt to use the least amount of muscular effort and energy to complete the circle until it would seem that just the intention itself and the movement of breathing were enough to enable the full arm circle. One can imagine being gently drawn apart by two people pulling outwardly on the arms, broadening the shoulders, and increasing the diameter of the barrel of the chest. With this improved diametric expansion, we allow more air into the lungs, and our ventilation improves even further. The cardiopulmonary circuit is happy, and this leads to a sense of generalized well-being in the body. With the last arm circle, we bring our arms together, crossing in front of ourselves, embrace the tiger of the energy that we would play with and let that subside. Left hand, moon rising, right hand, sun forming, sun rising, sun meets moon. Thank you very much.